Everyone present, all protocols duly observed. My name is Amenkhienan Ibidun Florence, and this afternoon I'll be presenting trends in the management of HIV/AIDS clients in a tertiary health facility in southwest Nigeria. Um, the scourge of HIV has negative impacts on human existence. Global trends in HIV prevalence are quite alarming despite the use of potent antiretroviral medications for many decades. Global trends have revealed that 38.1 million people have become infected with HIV, and there are 25 million people that have died from HIV/AIDS. In 2014, an estimated 36.9 million people were living with the virus, out of which 2.6 million children were inclusive. The global prevalence of HIV was 0.8%. However, majority of these people reside in developing nations like Nigeria, where I am. Of all these individuals living with HIV worldwide, 9% of them reside in Nigeria. However, the geographical distribution of HIV shows the prevalence of 2.1 to 4.0% in Ondo State, where I reside. In Owo, particularly the local government where I work of Ondo State in Nigeria, there are scanty data on the prevalence of HIV due to lack of record keeping. Summarizing the whole research work, records of seropositive patients that enrolled in the ALT care for 7 consecutive years was used in this study. Total number of males that attended the adults ALT clinic was 1,782, that's 46.5%, while the total number of females were 2,058. 53.5%. Enrollment in ART program will ensure access to drugs and help safeguard the future. ART drugs in combination, however, and have given patients and scientists new hope for fighting the epidemic and has significantly improved the life expectancy of clients to decades rather than to months. The big question now, so what? Global efforts have meant that the number of people receiving HIV treatment have increased dramatically in recent years, particularly in resource-poor countries like Nigeria. The big question is, what more can we do to help get to zero? In terms of new infection, in terms of transmission, and in terms of discrimination. According to WHO, team for World AIDS Day from 2014 to 2016. The background, I will rush through the background. As we all know, the meaning of HIV, human immunodeficiency virus, the diseases causes, the HIV virus causes AIDS. The HIV person may or may not have AIDS. They may or may not even have symptoms of the illness. And AIDS simply means acquired immune deficiency syndrome. Background now, we have 4 stages of progression of HIV: stage 1, stage 2, stage 3, stage 4, which is the full blown AIDS, and 3 major modes of transmission: sexual, parenteral, and mother to child transmission. However, prevention, as they say, is better than cure and far, far cheaper. And the modes of prevention are: A, for abstinence; B, faithful with your partner; C, consistent use of condom; E, empowerment through education, free testing, and post-exposure prophylaxis. However, the type of HIV care and services available at the federal at FMC Owo, where the study was done, includes adult HIV care, prevention of mother to child transmission, pediatric HIV management, HIV pharmacotherapy, post-exposure prophylaxis, and gene experts for TB co-infection. All activities of the Federal Medical Center Owo are in line with the national guidelines and policies of HIV/AIDS. The method used for this study, the study environment is Owo, which is an Asian town in Ondo State. It's located in southern west part of Nigeria with an estimated population of 276,226. Federal Medical Center Owo was established in 1993, and HIV care began as far back as 2006. In this study, secondary data was used. Medical records of seropositive clients enrolled in ART care for 7 consecutive years were retrieved, including the routine clinic visits and ward admissions. Data were analyzed using SPSS version 21.0, and descriptive studies was done. Frequency and proportions were used to summarize variables of interest. Ethical approval for the study was obtained from Health Research Ethics Committee of the hospital, and permission to sort for the medical records was obtained from the medical records department. From the study, this figure shows the total number of patients that were enrolled in the ART care. That's the adult care. We can see from 2016 we will have 151 clients, and in 2015 we had 177 clients. Enrollment and use of ART, that's the antiretroviral therapy. We can see the first green line up showing patient enrollment from 2006 to 2015. We can also see the active use of antiretroviral therapy. And the last line, the curve down in white, showing the number of deaths. We can see that the number of deaths significantly low. Number of patients that were transferred out from the facility, we had 1 in 2006 and about 50 in 2013, and in 2015, 31 patients were transferred out. Patient enrollment and lost to follow-up. However, in the management of these patients, there were some patients that were lost to follow-up. In 2006, you can see enrollment being 151 and lost to follow-up was minimal. And in 2015, you can see patients enrollment to 177 and about 19 patients were lost to follow-up. In the prevention of mother-to-child transmission, we have in 2016, we have 2,891 clients that were tested, and out of which 884 were positive. And the trend going from 2008 to 2015, where you have 1,578 that were tested and 173 that came out to be positive. You can see the decline in the number of people that came out to be positive. Now, this is counseling and testing of patients. The number of patients that were cancelled, the number of positive cases, and the antenatal cases too were also taken into consideration. We could see the number of positive patients from 2008 to 2015. Now, total number of adult clients that enrolled, however, were 3,844, and the highest enrollment in the year 2008, which was 22%, and the lowest enrollment that occurred in 2006, that was 6.5%. There is a correlation of enrollment and ART use. This shows that enrollment will provide better access to healthcare coverage and more health insurance options. Occurrence of deaths since onset of antiretroviral therapy use and patient enrollment has remained very low, significantly low, less than 10 clients per month. No death, however, occurred in the year 2006, 2011, and 2012. Reason for death in this year could be attributed to late presentation and other comorbidities like TB co-infection. ART drugs in combination give patients and scientists new hope for fighting epidemic and has significantly improved life expectancy to decades rather than months. We can also see the total number of positive pregnant women was 3,558. That's 18% of the pregnant women that were tested. However, there is an appreciable decline in the incidence of HIV among pregnant women from 2008 to 2015. That's from 25% to 4.9%. In conclusion, HIV/AIDS is critical for global public health attention and not only for the health sector. We have seen from these studies that early enrollment in the ALT care program will assure access to drug and help to safeguard the future. Adequate counseling will help form good habits and reduce the spread of HIV. Antiretroviral therapy is significant in reducing morbidity and mortality in HIV positive patients. And prevention of mother to child transmission too is very, very important and can actually help to get to zero in terms of transmission and infection. It could therefore be projected that mother to